All right, hello everyone. It looks like we have a pretty good contingent of audience members for today's session, so I think we'll go ahead and get underway. This is Anna Hoover. I'm Deputy Director of the National Coordinating Center for Public Health Services and Systems Research, and also the Public Health Practice-Based Research Networks. We have been having for the last month a new PHSSR Research in Progress webinar featuring many of our grantees through the Public Health Services and Systems Research portfolio, and today is a very exciting day, particularly for me, because we have some research on dissemination and building the evidence base for social media use in public health practice. As you know, the Public Health Services and Systems Research portfolio includes studies of everything from workforce to public health system structure and performance to financing and economics and information and technology. So we are deeply invested in supporting efforts in all of these avenues. Today we are very excited to have with us some of the leading scholars in the field, and including Dr. Jenine Harris, Dr. Ross Brownson, and Dr. Bashara Shokair, who will be getting things underway in just a couple of moments. I know one of our fearless leaders is calling in right now and is going to want to offer his greetings as soon as he's on the line, so we hope to hear from Douglas Scutchfield in just a moment. I also bring to all of you greetings from our director, Dr. Glenn Mays, who unfortunately can't be on the call today, but is equally excited about this work and about this Research in Progress seminar series. And I also want to upfront offer a tremendous thanks to Ann Kelly, one of our program managers here, who has invested a lot of time and energy in putting this series together. So it looks like Scutch is on the line. I'm not sure if his phone is working yet or not, but I'm going to turn things over to him for just a moment, and then I'll take it back for introductions. Are you with us, Scutch? Scutch, is that you? All right. He seems to be called into the webcam, but not necessarily on the phone just yet. Sometimes it takes a couple of minutes to dial in after you're online. So what we'll do is we'll go ahead and start the webinar, and then we'll ask Scutch for his comments immediately following the presentations. It's my privilege today to introduce to you three leaders in this area of building the evidence base for evidence-based public health, and in particular social media use in that area. So I will first tell you a little bit about our grantee, Dr. Jenine Harris, who will be presenting her work today. She joined the Brown School as an assistant professor in 2010, where she teaches biostatistics courses in the public health program. Her research agenda focuses on the use of systems approaches and network methods to understand and strengthen the public health system. Dr. Harris's current projects focus on the use of Twitter and other Web 2.0 technologies as a way to communicate health messages to the public and a way to facilitate partnerships among public health stakeholders. She has two mentors with her today, her research mentor and her practice mentor. Her research mentor is Dr. Ross Brownson. He's a leading expert, as many of you already know, in chronic disease prevention and an expert in the area of applied epidemiology. Professor Brownson is regarded as one of the great intellectual, educational, and practice leaders in the field of evidence-based public health. Currently, he's serving as a member of the Faculty Advisory Council of Washington University's Institute for Public Health. Dr. Brownson has a joint appointment with the University School of Medicine, is director of the Prevention Research Center, a CDC-funded center jointly led by Washington University and St. Louis University. Dr. Brownson is an associate editor of the Annual Review of Public Health and is on the editorial board of 5 other journals. He's president of the American College of Epidemiology, active in the American Public Health Association and the Missouri Public Health Association, the editor-author of the books Chronic Disease Epidemiology and Control, Applied Epidemiology, Evidence-Based Public Health, and Community-Based Prevention. Dr. Bashara Shokair is commissioner of the Chicago Department of Public Health. He will be joining us a little later in the call. He's coming straight from another meeting. He was appointed in 2009 and is reshaping the department to help meet the public health challenges of the 21st century. Born in Beirut, Lebanon, Dr. Shoker earned a Bachelor of Sciences degree in chemistry with distinction and a medical diploma from American University of Beirut. From 1997 to 2000, he completed a family practice residency at Baylor in Texas, and in 2009, he earned a master's degree in healthcare management from the University of Texas at Dallas. So those are some of the experts we're going to be hearing from. I think that we can go ahead and pass the baton to Jenine, and after the presentations, we'll get the comments from her mentors, and then we'll let Scotch have the moderator privilege of the first questions and comments immediately after. So, Dr. Harris?
Hi, everybody. Thank you first for spending some of your time today to think about social media and its potential for public health. Before I begin, I wanted to thank Dr. Bronson and Dr. Shoker, who have been fantastic mentors for me, and listening to their list of accomplishments makes me tired already. So, but I really couldn't have asked for a better team to work with on this. So I'm not sure I have to remind anybody on the call, as you're probably aware, informing and educating constituents about health is one of the 10 essential services provided by local health departments. And communicating with the public is also included in a number of the new requirements for accreditation of local health departments. One of the newer tools that local health departments have that they could use for educating, informing, and communicating is social media. So 85% of adults in the United States are online, and about 74% of these are using social media. So that gives us about 63% of all adults in the U.S. are on some form of social media. And although it varies a little bit by platform, social media use is not limited by race, ethnicity, sex, education, or anything, which makes it a really promising channel for reaching segments of the population that has traditionally been really hard to reach with health information. So of those 63% of the adults using social media in this country, about 15% of it are using it to seek health information. They're also using it for other health-related things, as you can see on the slide, but 15% are using it to seek health information. And that number is actually a few years old, which is a long time when you're talking about new technology, so it may have grown. There's some more recent research that says that about 80% of people online look for health information. We're just not sure how many of those are looking for it on social media. It's at least 15%. Not only is the public looking for health information online, but the public health professionals and healthcare professionals are also already using social media, so they're going to where the audience is, and they're using it for a variety of purposes. It's used, as you might imagine, to disseminate information. It's also used for surveillance. I'm sure you've heard about tracking the flu online. I'm going to talk a little bit more today about some surveillance related to foodborne illness. That's also something departments are doing. It's used for emergency management, and to somewhat less extent, it's used for conducting behavioral interventions. If you're interested in any of these areas in particular and how social media is being used, I put a few citations on the slide. I'm sure there are more out there in each category. These are just some examples. And as you can see, most of it is fairly recent work. So this is really an emerging area of research. New numbers, hot off the presses from NACCHO, have more than 40% of local health departments using Facebook and about 18% using Twitter. However, there's very little information on how health departments are they using it just primarily for disseminating information? Are they conducting interventions or surveillance? Are they managing emergencies? How are they using it? So given the potential of social media to contribute in all these areas, this project was designed to begin building an evidence base for public health practice around social media. And to do that, we had a couple of aims. So before we continue to build this area, we wanted to know what's already going on. So we wanted to conduct sort of an in-depth analysis of how local health departments are already using it. And then the second part of this project was to examine the connections that health departments have with their constituents and with other public health system holders on social media. So what are they using it for, and who are they already connected? All right, so most of what we've looked at so far is related to Twitter. So since the work I'm going to talk about is primarily about Twitter, I wanted to provide a little information on who uses the Twitter platform. Twitter is used by 18% of online adults in the U.S., making it one of the most widely used. There's a little bit of disagreement on this, but I think it's number 3. It's lower than Facebook, but it's still pretty high. Twitter is used relatively equally by men and women, by education category, as you can see across this bottom row, and by income category, relatively equal across those 3. There are some significant differences by race and ethnicity, with non-Hispanic blacks using Twitter at a much higher rate than non-Hispanic whites or Hispanic groups. People in rural areas use it less often, and people over 50 are less likely to be on Twitter compared to their younger counterparts. Local health departments started adopting Twitter in about 2006, and the number of health departments have been rising steadily over time. The most recent number was about 18% from NACCHO, 40% on Facebook, 18% on Twitter. The health departments that have adopted Twitter are what we found is they are in jurisdiction with larger populations, so they're in more urban areas. They tend to employ public information specialists, which is a staff member that would likely be in charge of Twitter and other information channels, and they spend more per capita. By spring of 2012, health departments had about 400 Twitter followers on average. I checked this again last month in January, and they have closer to 675. So in a little under 2 years, the average number of followers on Twitter for a health department has increased by more than 50%. But it's still pretty low. It's still around 4.5 followers per 1,000 people in a jurisdiction. It's much lower than the overall rate of use of Twitter. Having more followers for a health department, it was significantly associated with sending out more tweets, serving a larger population size, having a bigger budget, and having a public information. And those things, you'll notice, were some of the same things that were associated with adopting Twitter in the first place. So local health departments, they have a lot more followers than I do. There's me with just 56 followers, but they have a lot fewer than the UK football team. So I really believe there's still ample room to grow for local health departments in this area in terms of larger audiences. All right, so once we knew sort of who was using Twitter and how many followers they had and some other things, there were some other really basic things we wanted to know about health departments using Twitter. Although they've been adopting these channels since 2006, social media is still something of a new frontier for health departments. And one of the things we noticed first when we were working in this area was that it wasn't always easy to figure out which health departments actually had social media accounts. It wasn't always easy to find a health department on Twitter or on Facebook. So we did a small study as part of this larger project to see how easy it was to find health departments we already knew were using Twitter. So places we already had usernames for and more information about. We put the health department names into the search box on Twitter, and we recorded whether or not the search tool actually found the health department. And what we found was that health departments that had done a more comprehensive or complete job at filling out their profiles were more likely to be found. So they had their full name in their Twitter profile. We also found that those who had been tweeting more often were easier to find. And that's a function of how the Twitter search tool is built. We were less likely to find health departments that were using initials like LL.Ph.D. or CU.Ph.D., especially if they didn't have the full health department name somewhere within their profile. This has some implications for health departments. If it's harder to find you online, people are probably going to be less likely to find you. All right, so once we finished with that, we wanted to take a closer look at who had found the health departments, who was following local health departments online. We wanted to know a little bit more about the audience for the information health departments are sending out. We found that overall, health departments were being followed by more organizations than individuals. So 58% of the followers for health departments were organizations, 42% were individuals. The organizations had a tendency to be health-focused more than individuals. So an example of that would be the CDC or the NIH or RWJF. So organizations were health-focused. Individuals tended to be local. They tended to be in-state. So people were following health departments that are nearby, while organizations were about half and half, in-state and not in-state. You can see a little breakdown there on the chart of what industries the organizations and the people were representing. Most of the people following health departments would not talk about a specific industry. They were more like, you know, a stay-at-home mom or father of three, things like that in their profile rather than a specific industry. All right, and so once we knew a little bit more about the followers, we wanted to know something about what health departments were tweeting. So there was one recent study that found that local health departments were tweeting mostly about individual health behaviors. So we were interested in whether the tweeting was about health behaviors that were consistent maybe with local health outcomes or indicators. So our health departments in areas with high smoking rates tweeting more about smoking, things like that. So we chose to look at diabetes, and we chose that as a note for a number of reasons, one of which is that people with diabetes are extremely active on social media. There's a bunch of different social media sites specifically for people living with diabetes, and they seem very active in those sites. So in this case, we wanted to know whether health departments in jurisdictions with higher diabetes rates would be tweeting more about diabetes. The map shows diabetes rates as higher in the darker shades of blue, and the gray circles are the number of diabetes tweets coming from a health department in that particular jurisdiction. So what we found was sort of a mixed bag. We found that health departments with higher rates rates of diabetes were no more or less likely to be tweeting about diabetes than health departments in jurisdictions with lower rates. However, health departments that were tweeting about diabetes were tweeting more about diabetes in places where there was a higher rate. So it's a little bit of a mixed bag. In addition to just knowing whether or not that sort of matched, we wanted to know more about the content of the tweets that health departments were sending out. So we looked at about 1,100 diabetes tweets sent by more than 100 health departments. Over half of them included some sort of cue to action. So a phone number to call or a website to click, some way to do something more. About a third of them, the tweets there in the middle labeled risk, those included sort of epidemiologic information. This one says nearly 26 million Americans have diabetes. It's the seventh leading U.S. cause of death. And then a small number included information on specific health benefits related to health behavior. So these are the three types of tweets we saw. So we know now a little bit about who is finding and following health departments and the sort of information that they are sending out. But how are health departments, how are the followers engaging with the local health department information? The volume of information, for those of you on Twitter or Facebook or any of the social media platforms, you can attest to this. The volume of information that comes across is enormous. So just following a health department doesn't necessarily mean that you're going to see or read or share the information they're sending out. So last year in 2013, there were some metrics proposed to measure engagement for health promotion organizations and individuals. And this would measure just how much the audience was interacting with what the Twitter users were sending out. And so what we're doing right now And we're right in the middle of this. Twitter changed the way they allowed you to collect data in January, so it's making it a lot more difficult to get some of this information. But we're looking primarily at some of the medium engagement indicators. The indicators of low engagement are things like the number of Twitter followers and the number of tweets, and we sort of already had that information. And so we're interested in some of the medium engagement metrics, which are more about how are people interacting with the information health departments are sending. And what we're finding is that about 13% of tweets from health departments are being retweeted by somebody, and about a little over a quarter of those are being retweeted by non-followers. So these are people who are not following the health department, but they find the information in another way. They might be looking for a keyword, they might be looking for a hashtag. They find the health department's tweet in a different way, and then they retweet it to their followers. A pretty high number of the retweeters were unique, so that's actually a good thing. You don't want your stuff to get retweeted by the same person over and over again, because then it's not reaching a more diverse audience. And then those last two, I'm not going to go into those right now, but I'd be happy to talk about them if we have time later. Mentions and mutual relationships are a couple of the more complex medium engagement indicators. They're both pretty high here. And I'd be happy to talk about that more later on. All right, so here's a couple really interesting things.
Hey, lady.
So as we're learning more about general indicators of engagement, we thought it would be useful to examine a couple examples of engagement. The first was e-cigarettes, which are a pretty hot topic right now as the policy landscape starts to change. There's really no federal regulation of e-cigarettes and very little state and local regulation. So in nearly half of states, minors can buy e-cigarettes, and they come in flavors like watermelon and cotton candy. And I believe the CDC recently found that the percent of middle school students buying e-cigarettes is increasing at an alarming rate. So there's a lot going on around e-cigarettes right now. And industry and its supporters are defining e-cigarettes as a cessation aid, a way to quit smoking. And then public health is finding that they're a way to get new customers sort of in the door for the tobacco industry, to get them started on nicotine at a young age while there's very little regulation. So the Chicago Department of Public Health had some experience with using Twitter to send out some information about e-cigarettes. On January 8th, this is a week before a Chicago City Council vote to become the second city in the country after New York to restrict indoor use of electronic cigarettes. The Chicago Department of Public Health released a set of tweets about cigarettes over the course of about 3 hours. It started with a tweet at 10:05 in the morning. E-cigarettes look like, are labeled like, and contain nicotine like cigarettes. They should be regulated. Let's talk about it. Over the next 2.5 hours, well, actually, they sent out a few more. They sent out one about the percentage of middle school students and high school students doubling in over the course of a year, and then a tweet about what's in e-cigarettes, and altogether I think they sent out about 10 or so different tweets about e-cigarettes. Over the course of 2.5 hours or so, the Chicago Mayor's Office, the medical school at the University of Illinois, Chicago City College, and a few other local partners retweeted some of these tweets, and that would look something like that. So they retweeted what the health department had sent. But within minutes of the final tweet sent by the health department, the first tweet from a proponent of electronic cigarettes appeared in the health department's Twitter feed. So this was just after noon, and this person says it's actually people who have successfully stopped smoking with e-cigarettes. So there's that cessation argument. And then who vape sweet flavors. And vape is the term for cigarettes, for those of you who are not familiar. And so over the next 12 hours, there were about a dozen more tweets like this one from supporters of the e-cigarettes. And then around midnight, the following tweet went out from a Twitter user who runs a pro e-cigarette website. He makes all his money from cigarettes. So he said, we need to Twitter bomb the hell out of Chicago Public Health, spreading nothing but lies. And so over the course of the next week, the Chicago Public Health Twitter feed, the Twitter accounts of the health commissioners, and several city council members were Twitter bombed. They got messages like this in their Twitter feeds all day. The Chicago Health Department by itself had about 650 tweets like this over the course of the week. On January 15th, this tweet went out that the Chicago City Council had voted to pass the ban for e-cigarettes in bars, restaurants, or public places. But that has not stopped the Twitter bombing. It's still going on. The electronic cigarette supporters are still sending tweets like this to the health department, the commissioner, and others in Chicago. So we're currently working with the Chicago Health Department to examine what happened and what we can learn from how the industry responded and these supporters responded. This is a great example of Twitter users being engaged with the health department, but maybe not in the way that we would hope when we send out health information. So we definitely need to learn some more. Another, maybe more positive form of engagement was the Foodborne Chicago project. The Chicago Department of Public Health uses Twitter for surveillance of local foodborne illness. So they identify tweets that appear to be describing food poisoning in the Chicago area, and they reply to the Twitter users and direct them to a form where they can identify more details about the restaurant or the food or the illness. Some of these forms may lead to inspections of restaurants. So this is one example of both surveillance and high engagement on behalf of Chicago's Public Health Department, where Twitter users are participating in finding and fixing a public health problem in their city. So to me, projects like this one that use social media to partner with citizens to improve local public health represent a really promising future for social media use in public health. And we are just starting to evaluate this as well. We just got this data probably in the last week, start looking at how this particular program is working. Okay, and so to change gears a little, the very last topic I have today is a few slides on the links between health departments and others on Twitter. We know something about who health departments are connected to, what sorts of information they're sending out, and how they're engaging with their constituents. But health departments are not only followed, they also follow others on Twitter. So they also get information from others on Twitter. So this last section is about who the health departments are following and how these linkages might be used for information sharing. So overall, we found that health departments, and this was probably about a little under a year ago that we collected this information, that health departments are following about 20,000 unique users. So we looked at the top users, the users that are followed by at least 10% of health departments. And it turns out that those are Twitter users from government, from media, from nonprofits. You can see a list there on the bottom of the page. It turns out within that list are about 12 health departments. So health departments are starting to follow each other on Twitter. So there's sort of a natural network of health departments who are connected to one each other through social media links. And the top 10, this isn't actually the top 10, it's the top 8, but this is just a listing of some of the top sources that local health departments are following. You can see that there are four CDC accounts. The CDC actually has, I think, 12 Twitter accounts, and some for different purposes. So 4 of these turn up in the top 8 sources for public health departments. There are a couple of professional organizations here, and then a couple of non-CDC governmental agencies. And you can see on the right there how many health departments are following each of these different Twitter accounts. So when we saw that health departments were following each other quite a bit, we thought that we'd take a look and see what some of the patterns of connections are among these health departments. Connections among organizations have the ability to facilitate dissemination, to encourage implementation of programming. So we wanted to just take a closer look. So the figure on the slide shows a network of health departments that are following each other on Twitter. The orange nodes are all the connected health departments. There's 186. And the green nodes are health departments that are neither followed nor being followed by any other health department on Twitter. So in a network like this, the weaker connections where I may be following you, but you're not following me back, those can facilitate dissemination. And strong connections where we're both following each other can facilitate implementation. And I have a whole paper on this that I'm happy to send people who are interested in some of the networks. So once we took a look at the properties of that network, we found that health departments tend to follow larger health departments, and they tend to follow ones that are geographically close to them, so either in their state or sharing a border. So with these types of connections, new information is going to generally come to you from large health departments and health departments that are nearby. And this is great, but these ties sort of limit the flow, maybe limiting the flow of innovation across the network. So it's no more difficult to connect to a health department that's a different size from yours or in a different part of the country. And this may facilitate, connections like these could facilitate exchange of ideas in ways that are bringing new ideas to different people more often. By connecting to a variety of local health departments with varying size and resources, health departments could potentially be exposed to new strategies or new ways of implementing through these ties that there already exist. So that was sort of the last new slide. And I'm just going to sort of summarize what I've said so far and then where we're going next. Local health departments are adopting and using social media, especially health departments in larger jurisdictions, health departments specialized staff like public information specialists. Local health departments have relatively few followers on social media compared to the size of their jurisdiction, so there's some room to grow there. More than half the followers are organizations rather than individuals. Just over half are in the same state as the health department, and about a third have a health focus. Health departments are using Twitter to send out individually focused health information, which doesn't always correspond perfectly with health indicators in their jurisdiction. They do have moderate levels of engagement with their followers from what we are. However, the engagement takes many and can be very positive for public health, like Foodborne Chicago, or it might present challenges for public health that we need to learn to address, like the e-cigarette Twitter bombing. Health departments are following large governmental health organizations like the CDC, the FDA, professional organizations, and others. And these pathways could facilitate dissemination of best practices to an although we've learned a lot so far, this area is really still emerging. As public health practitioners adopt Twitter and other social media tools and develop new strategies, it'll be really important to understand which strategies are effective, how we can make them more effective, how we can foster engagement, how we can use the things social media is best at to the advantage of practitioners. And finally, there are lots of tools out there for evaluating social media, but many of them have been developed in fields like engineering and computer science, and they require skills beyond those of the typical social scientist practitioner. So moving this field forward is going to require some new partnerships between practice, public health research, and computer science and engineering folks in order to really be successful. And that's it. I look forward to your comments and questions. You can follow me on Twitter if you like, but I don't tweet very often.
Thank you so much, Jenine. That was a terrific presentation. And I think before we open the floor for questions, we will turn over to Dr. Brownson and see if he would like to make some comments about the project.
Sure, yeah. Can you hear me? Yep, okay. Hi, everyone. This is Ross Brownson in St. Louis, and Jenine is in the same institution, but we're not in the same room together. Jenine, great job on the presentation. I think it's really an exciting area and just shows the role of these new emerging technologies and how it may affect public health and PHSSR. The first thing I wondered is when Scutch comes on, he'll have to tell us how many followers the UK basketball team has, not the UK football team, but that'll come later. I had a couple comments about the content area. One, I thought it's really interesting with these sorts of emerging technologies, and maybe this will apply for others on the telephone, to think about, what evidence-based means. We're getting to know quite a bit about what evidence-based public health or medicine means, but for a technology like this, is it the content of a tweet? Is it how social media engages between the followers and the originators of the information? Is it how well it's evaluated and whether it has any impact, or even as simple as a process evaluation? So I think we still have a long way to go in this kind of early work on what that evidence base for something like social media or another emerging technology might mean. I think, as Jenine mentioned, this is a great example where a lot of the progress and sort of collaborations are going to need to link outside of traditional public health disciplines with areas like computer science and communication. And I think that is something that we're working on here, and we can always do better at engaging these other sectors who may not immediately have a big stake in health, at least up front. And then the last thing I wanted to say was just thinking about sort of in typical governmental public health, maybe how we can learn more from the private sector, where there's tweeting about a product or a new some new entertainment, a new movie or something else, that maybe this is an area where, from the private sector and from sort of popular culture, we can more quickly move along in areas of public health so that we can move our field forward and improve health and the quality of life for the various populations we serve. So I think there's a lot of promise and excitement about this area. Still a long way to go, but Jenine, I think, did a wonderful job presenting some snippets of some of the work that she's been working on, which I think is kind of the early phase of a lot of this work that I think will be useful for all of us as we go forward in the future. So I'll leave it at that.
Thank you, Dr. Brownson. I know Dr. Shokera was going to be joining us after another meeting. Is he on the line? All right. Dr. Shokera is not with us yet. Hopefully we'll hear from him by the end of the call. But in the meantime, Scutch, I'm going to kick it to you for a moment.
First of all, let me apologize for my delay in getting on. Like Ross, I'm in a bit of different place from the University of Kentucky, so I got confused by the time, and I apologize for that to the group. Ross, in response to your question, there are 58.8K followers of UK basketball on Twitter. As you can see, the basketball team is much more appreciated in the Commonwealth of Kentucky than is the football team. So that's a reflection of how effective this has been. I think there are two things I wondered about, Jenine. I'm struck by the fact that there's organizational communication that's going on, and I think one of the things that some of us have been interested in and concerned about is the whole notion of sociological determinants of health and how health departments can take leadership with that. And with the number of institutional relationships, followers on that, wonder the extent to which you have examined local institutional, governmental kinds of institutional relationships that might result in further upstream interventions on the part of specific other components of the healthcare system, which I think would be of interest. The other thing, of course, that would be a very, very strong interest, and that is the extent to which you're able to change behavior, change activities, whatever, if in fact you're able to get out evidence-based interventions, and the extent to which those are likely to impact the population that you're attempting to focus on. So I'd be really interested in the extent to which you all have begun to think about how you might construct, and I'm sure you have, some notion of the impact or the reach, that you're experiencing with the Twitter.
Hi, this is Jenine. So the first question about inter-organizational communication and how we might leverage that for public health. So far, the only thing we've really looked at, but I think there's a lot of potential there. So far, we've just looked at the ties among organizations, sort of how dense those networks are. I was on another webinar earlier this week with the NATO emergency preparedness folks, and had a health department come with a question saying that she had all her partners were following her, so CDC folks were following her, WJF folks were following her, but she couldn't get local individuals to follow her. So I think there really is maybe this large interorganizational network forming among public health organizations across these social media platforms, maybe more so at this point than the local constituents are following health departments and other organizations. I haven't really looked at it beyond that, but I think there's potential there for information sharing, maybe having public health keywords and hashtags that can be used by organizations to share when a new best practice is developed, or when a program works for a health department, to share that information through this large emerging network of organizations. I think the potential is there. I don't think anybody has studied it in depth yet, although I would like to. And then the second thing about behavior change, social media use prompting behavior change, there have been a few small studies looking at very specific behavior changes. One study that I can remember is about continuing to not smoke after pregnancy. And this study used the social media prompts to help people sort of get involved in a group and have some social support around that, and they found that it was it increased the rate of continuous cessation after after pregnancy. So there are a couple other similar studies where very small, very specific behavior changes were observed following a social media intervention. We haven't ourselves sort of thing.
Thank you, Jenine. This is Anna back at the coordinating center. We're going to open up for questions in just a second. I'm going to exercise moderator prerogative and point out a couple of things real quickly. First and foremost, Kara Richardson, our communications director, has posted in the chat box links to a couple of articles Dr. Harris has written and published in Frontiers in PHSSR. Those of you on the call may be interested in having a more in-depth look at those. I would also, I just want to follow up on something Dr. Brownson mentioned earlier about the potential partnership with health communication, and I think there's something very valuable in noting that, because obviously we do have an organizational communication subfield, and there's also a health communication subfield, and the health communication subfield tends to be very focused on those behavioral interventions. What gets communicated to the individual in what way to make a behavior change, as opposed to the organizational piece, which is an intervention in and of itself. And what is the optimal point of entry within the organization to ensure that the evidence-based practice becomes diffused through the system and becomes adopted. So I think that there are ways to bring together subfields of health communication and organizational communication very productively to help build the evidence base for social media use, as Jenine is working on right here. I would also say that I think there's some interesting opportunities based on your social network analysis there to look at how you might use @tagging to ensure that certain tweets, if you are disseminating the evidence-based practice, I know you have some folks on the line from CDC and different organizations, if there's an evidence-based practice that you're trying to push out, to maybe @tag some of those large health departments that have lots and lots of followers, but make sure you're @tagging geographically dispersed large organizations in hopes of reaching as far across as possible. And so I think that there are some really practical, for PIOs and communications folks, there are some really practical implications for the work that's being done here. That said, I think I'm going to read now a question from Paul Irwin, but I would note that After this question, if you have a question, please raise your hand up at the top of your Adobe Connect if you're on the computer, or you can type your questions in the chat box, or if you're on the phone, just jump in. But our first question is from Paul Irwin from the University of Tennessee, who says, Janine, nice work. What would you suggest as an immediate approach local health departments can use to determine the value of using Twitter?
So I think that some of those indicators of engagement are interesting for local health departments who are interested in whether or not the time they're putting into Twitter or Facebook or whatever is actually time well spent. I'm not sure we have gold standard metrics yet, but if you want to look at how often your messages are being retweeted, some of those very basic engagement metrics will give you some idea of whether or not your audience is getting involved with the information you're sending out, and that might be helpful in determining whether or not Twitter use is going well for your particular organization. There are also ways to increase followers by connecting to, like Anna was saying, maybe tagging some of the larger health departments so that your tweet that shows up in their Twitter feed and then is potentially retweeted by some of their audience as well. So there are ways to increase engagement. But I think if you want to see how well your Twitter stuff is doing so far, just using some of those basic metrics like how many people are retweeting, how many people are liking and replying to the information that you put out there.
Great. Thanks, Janine.
Sure.
And I'd like to also just add that you also might want to devise some ways of looking at what's coming in, what pieces of information you're getting through Twitter that you might not have gotten other places. If you're following some of these organizations, are you getting information that you need operationally more quickly than you might get from non-Twitter sources? So don't lose sight of what's coming in as you're evaluating what's going out as well.
Right, good point.
Next question, who would like to jump in and ask the next question? Well, I'll jump in and ask the next one while folks are gathering their thoughts. Janine, you mentioned that more followers was associated with more tweets. Were you able to establish directionality on that? Is it that the organizations that are tweeting more are garnering more followers, or because they have more followers, it's pushing them to tweet more? Did you get any sense of how that dynamic is working?
So, I mean, there are other studies aside from what I've done that have shown that the more you tweet, the more people will follow you. So I didn't look at sort of dates of tweeting and dates of followers following. So I can't make a causal argument statistically, but the evidence generally shows that if you tweet, and I think the optimal number of tweets is like 4 per day. If you tweet more often, people will tend to follow you because you're sending them information on a regular basis, and they're retweeting it, and that's causing other people to follow you. And so it all builds on.
Thank you.
Sure.
Do we have other questions? Well, I think this is a good opportunity to point out to folks who found the social network analysis in this presentation of interest for Janine to talk a little bit about another success story she has ongoing right now that we're going to have some opportunities to highlight at the Keeneland Conference coming up in April. Janine, would you like to talk a little bit about that?
Oh, sure. So I have a new little book out that is basically a how-to for using statistical methods to analyze social networks. And for those of you who are familiar with the Sage Little Green books, it's one of those. And so it's very small, and it's very much sort of a how-to, and it uses the NACCHO network of local health departments as the data source. So not only would you get some information about how to do the analysis, that you'd be using a data set that's consistent with PHSSR and that looks at linkages among local health departments. And so I'll be at the Human Conference, and I'll have some books there. And anybody who's interested, I'm happy to talk about it. The data source is online, so you can follow along with everything in the book pretty easily, I hope. I'd love feedback if anybody has it or sees it.
Thank you. And Kara has put the link to the book in the chat box, along with those articles that she put up earlier. Do we have any other questions for Dr. Harris or Dr. Brownson?
Won't let the name of the book scare you away.
Looks like Robin Pendley is working on a question right now, so while she does that, I'll ask again if Dr. Shokare has managed to make it on the line just yet. No, it looks like his meeting might have run just a little bit long. All right. Robin has a question. Outside of Twitter and Facebook, do you have any sense of any social media tools that LHDs are using?
I actually have been starting to look into Instagram. So among young adults, Instagram is the fastest growing, and it's second just to Facebook if you're trying to reach 18 to 29-year-olds. And there are several health departments that are starting to use Instagram to do more visual sorts of campaigns. Again, you can go out and look at Chicago's use of this. It's really great. I think they integrate some of the different platforms, so they'll send out messages and images across multiple platforms, and Instagram is one that they've been using.
And I know that a couple of public health practice-based research networks are working with the UK Prevention Research Center to look at face-to-face versus YouTube as delivery mechanisms for a video screening intervention. So they're working with local health departments here in Kentucky and in North Carolina to sort of compare what the outcomes are, whether you're using the face-to-face intervention or just providing the link to your LHD constituents via YouTube and the website. So I know that there's some of that kind of work going on too, looking at YouTube. Well,
industry has also been using YouTube, especially e-cigarettes lately have been using YouTube to show people how to use their products. And so to Dr. Bronson's point that we could maybe take some cues from industry, I think looking at where industry is right now and maybe what public health can learn from that in relation to social media is a good way to go next as well.
Well, it looks like we're just about to run out of time. I'll just ask one more time if Jenine or Dr. Brownson has any closing thoughts they'd like to share before we sign off for this edition of the Research in Progress webinar.
Nothing really from Ross. I think that it was really an interesting seminar, Jenine, and I hope others can get something out of it. And Jenine really is an expert on this, so I know she's glad to answer any questions if you have follow-up. So great job.
Yes, I would love to hear from anybody who has questions or who has different experiences with using social media, whether at a local health department or another sort of organization. The more information we can gather at this point, the better. So thank you guys all for listening.
Thanks to both of you, and we look forward to you all joining us on the next Research in Progress webinar coming up March the 12th. You'll be getting mailers about that very soon. Thanks so much, and we look forward to talking to you in the near future.